Good morning, everyone, and welcome to Day 2 of PYA Summer CPE Symposium, Hot Topics in Healthcare. I'm Catherine Good, a principal with PYA's Audit and Assurance team, and on behalf of PYA, I'm pleased to welcome you to our 5th annual Summer CPE Symposium. PYA is happy to present these complimentary virtual learning opportunities for our healthcare colleagues across the country. Over 2 days, PYA thought leaders will present a total of 4 sessions and provide information on trending topics with key takeaways and helpful tools for you and your organizations. Today's presentations are Not All Practices Are Created Equally, Why Physician Practice Value Varies by Specialty, and AI in Healthcare Cybersecurity, Risks, Compliance, and Practice. With that, I'll hand it over to our moderator for information on getting CPE credit.
Thank you, Catherine. As this event is for CPE credit, there are some additional steps that we'll take in order to comply with NASBA's requests. In accordance with NASBA, attendees will be provided with 3 polling questions during this session. Responses are documented electronically. Attendees must respond to these polling questions within the allotted time in order to receive CPE credit. At the close of the session, a post-event survey will also be provided for attendees to submit feedback regarding their webinar experience. The polling questions and post-event survey must be submitted for proof of participation today. Credits will only be earned for sessions attended in their entirety. Your CPE certificates are downloadable via the continuing education pane once you've completed all the requirements. We've posted a PDF copy of the presentation slides for your reference in the resources pane. Also, all sessions are recorded, and you'll receive an email later today with a link to a copy of the slides and a recording of the webinar. You may submit questions directly to today's presenter by typing a message into the Q&A pane. We'll collect these and they'll be responded to individually via email after the event. Registration is still open for the remaining summer symposium session, and we hope you'll join us. For more information and to register, visit the Thought Leadership section of our website at pyapc.com. With that, I'd like to introduce our presenter, Matt Warren.
My name is Matt Warren. I'm a principal with PYA. I sit in our Knoxville office and am one of the leaders of our business valuation practice. I'm very excited to speak with this group today and spend a few minutes talking about physician practices and how they are valued. But as we said on the front end, this is the Summer CPE Symposium, and that just reminds us all that summertime is really here right now. It's hard to believe. You look at the calendar and it's June 24th today. So hopefully everybody's summer is off to a really good start. Hopefully by now everybody's had the chance to get out, maybe spend some time at the pool, spend some time out grilling, creating a barbecue with burgers, and great time to spend time with family and friends. Perhaps you've taken a vacation or have one coming up in the next couple of weeks. I know we've all got a big holiday coming up next weekend. It just starts to feel like that old Kenny Chesney song. Summertime is finally here. That old ballpark, man, it's back in gear. And that brings us to the ballpark. I always think of this as one of the best parts of summer. So our family, just to start us off a little bit, happens to be big baseball fans. This is a couple of pictures of us from recent excursions to the park. My older son, Andy, you can see him here. He actually plays Little League, and I actually had the chance to coach him this past season. He was part of the Houston Astros. So if you know the history there regarding the cheating scandal a few years ago, I want to be clear that there was no cheating this year. And then my daughter here, she's our middle child. Her name's Madison. We've gone to the ballpark probably 3 or 4 times already this year. She's always super excited about it for very different reasons. We talk about going to the baseball game, and her first reaction is, popcorn. So she always gets excited when we go there, and she gets to snack for a little while. And then my youngest child, Benjamin, you can't see him as much in this picture, but he's actually dressed up as a little baseball. He loves going there mostly because it's warm and he tends to get a good nap. But we'll work on him a little bit. But going back a little bit to the Little League reference, as I mentioned, I had a chance to help coach with Andy's 6 and under team this year for Coach Pitch. And I'll just ask everyone, how many of us have seen Little League baseball teams? At this age, they're still working and throwing and catching well. One of the things that I learned quickly when I started spending some more time around this league and starting to coach it was there's actually more value in this league in getting outs than there is a run. There's a 5-run limit, and usually the scores end up being 15-15 if you don't get enough outs. So getting those 3 outs becomes quite a big deal. It's just very different than a lot of the games that we think of when we think about baseball. But it's something that we've all seen, and this is still a baseball team, right? It's 9 individuals going out there playing the game that many of us know and love and have been familiar with over time. On the flip side, there's the other side. There's professional baseball teams. These guys are, they're ridiculously good. I know we've all probably seen them on TV at some point, and I personally have a lot of respect for what they do. You think about just the pitching part of it. For context, that home plate that they're throwing the ball over it's about 17 inches wide, which if you want to compare that, it's about the size of a laptop. Not very wide, and they're throwing it from 60 feet and 6 inches away. So that's about the length of a semi-trailer. I don't know if anybody in here has tried to throw a strike that goes over that home plate, but I can tell you personally, I can't. That's probably part of the reason that my day job is here and not coaching baseball teams. But the moral of the story is that these guys are really good at that level. They're really good teams. They've got a lot of really valuable players on the team. And I know you're probably thinking, why are we sitting here talking about baseball today? Everybody came to this for CPE credit, right? It's a CPE symposium. You're probably expecting charts and graphs. I think that might even be part of the NASBA requirements to get CPE. But when we think about baseball teams, there's a wide variety out there. Everything from my son's Little League team to the Dodgers and the Yankees that everybody hears about. Both of those, for reference, are valued at over $9 billion with a B. I mean, they're huge money-making operations. But again, they're all baseball teams, right? They're all playing that same game. There's a lot of nuance and a lot of differences between them. There's a lot of things that add value and make the Dodgers and the Yankees what they are. But there's a lot of similarities between this and physician practices. We hear a lot of questions in the group that I work with. We hear the question, how do you value a physician practice? And my first response when I hear that is almost always the same. It's tell me more. I want to understand the nuances of the practice, the different components that make it successful. Those are the things that help me understand the value of each of these. And today we're going to spend a little bit of time going through those in hopes that you learn a little bit more and hopefully have an appreciation for what really adds value and drives value for a physician practice. So what are we going to cover today? Here's just a quick agenda, but we're going to spend a little bit of time orienting everybody to the topic, explaining a few key terms to make sure we're all speaking the same language as we talk through this. We'll spend a few minutes on valuation approaches so everybody can understand what's the key aspects and the key analyses that our team works through when we're looking to value any entity, but in this case, particularly a physician practice. We'll talk a little bit about some of the challenges that we've run into, and this is going to be very focused on physician practice valuation, but a number of these challenges would be in play for others as well. We'll go through high level some specialties because there's a lot of difference between these specialties, just like there's a lot of difference between the baseball teams that we've talked about. Help explain a little bit of why somebody sees value in one and a little bit less value in another. And then we'll talk a little bit about some other considerations. These will be things like how the specific buyer can impact the value of the practice. Private equity is a very popular topic and question that we get now, so we'll talk a little bit about how that works as well. So let's dive in a little bit deeper. Just to, again, orient everybody in terms of what we're talking about, I wanted to make sure to point out a few key terms that you're going to see throughout this presentation. When we're talking about value, that is a forward-looking concept that's thinking about what something is worth in expressed in a unit of measurement. So it's going to be dollars for our purposes. It's based on a principle of substitution. So it's based on a buyer and seller being willing to work through a process and talk about what a collective price would be. We'll talk about price a little bit more in a second. But value is really what is the economic value that somebody would get if they had an ownership interest in the entity that we're talking about. Price is very similar to a lot of people, and those terms get used interchangeably, but there is a difference. Price is really the actual amount of money agreed upon in a specific transaction. I think we can all think about times that we've overpaid for something or underpaid for something. You hear terms like that and you think about, well, maybe I got more value out of that than I paid for it. That's just an indication that the price was set below that value that you might have. Alternatively, the value may be the same and you may have overpaid for it. This happens a lot when there's a slower supply. So you start to see prices go up, even though the value you're getting, it's the same. We're going to use the term fair market value. That's a specific and defined term. It's really set out initially by the IRS, and we talk about it and share the definition here, but it's focused on a willing buyer and willing seller. Again, it's the price that it would change hands, but it's really based on the willing buyer, willing seller negotiating. Neither is under any compulsion to buy or sell, which means that there's no pressure here. There's no fire sale. And both have to have reasonable knowledge of the relevant facts. So it should be informed market participants. The same definition is very similar to what you see in START, which I know is applicable for a lot of folks here. And it really serves as a framework for a lot of valuation approaches. So wanted to make sure to share that definition with everybody. And then we'll talk a little bit about valuation. This is the act or process of determining the value of a business. This is the work that our team does. We value probably 100 plus entities a year. And this is the act of going through really understanding the business, understanding what drives it, developing a valuation report, and working through that entire engagement. So with that, we'll spend a few more minutes focused on valuation approaches. And I think this will help set the foundation that hopefully everybody in here will build a little appreciation of the process that we go through, and start to understand what we're thinking of when we talk about some of these additional nuances later in the presentation focused on specialties and physician practices. So I'm going to go back again to the baseball team analogy. There's really only three approaches that any valuator can take to value anything. We're going to talk about it in the context of a business, and more specifically, in this case, a baseball team, but we'll turn this a little bit towards physician practices. But that same approach is the same in any type of appraisal, whether that's a house that you may be purchasing, a stock that you're buying on the stock market, jewelry, any type of asset out there that you could be buying. You would take the same three basic valuation approaches to understand the value. So using the baseball analogy, we'll go through each of these. You've got the asset approach, the income approach, and the market approach. The asset approach is relatively straightforward in my mind. It's a question of how much would it cost to build a baseball team. It's straightforward to understand, but the nuance can be complicated. If you start to think through what it might take to build, especially a professional baseball team, you've really got to build it up from scratch. Obviously you're going to need a lot of players in that case. You need a stadium to play the games in. You would need a front office, the administrative staff to help work through it. Player contracts, helping negotiate terms with everybody. You'll need your setup for ancillary services, whether it's concession stands or souvenir stands. You can compile all of those together, and that becomes the foundation of your asset approach. It's based on those anticipated costs to either recreate or replace that asset. So if I wanted to build a team from scratch, these are the different components that I would think about. I would add them all up, and that would be my cost to rebuild it. Then there's the income approach. The income approach I think about is how much profit can I make from owning a team? The basics of this are going to be something that folks here are very familiar with. If you've got a background in the accounting space, you're going to have a big revenue number. You're going to take out salaries. You'll take out expenses for the supporting workforce, for the cost of the stadium, for repairs, for maintenance, advertisement, all of those expenses, and then you'll be left with your profits. How much would somebody pay for those profits? You've got to think about the risk associated with it. You've got to think about other factors such as future strategic decisions you've got to make and strategic investments you have to make. But all of that would come together in a cash flow model where you can sit here and say, here's the value in the future, here's the risk associated with it. Let's come back to the present value of those cash flows and decide what that value is worth today. So that's the income approach. The market approach is going to be focused on how much would a professional team sell for. Going back to some of our analogies earlier, we talked about the Yankees may be valued at about $9 billion. But if you look at some of the more recent transactions out there, Tampa Bay's been bought for about $1.7 billion, I saw, and San Diego for about $3.9 billion. Again, really high dollar numbers and very big differences between them. But you can take those data points and assume, there's going to be some value that you can assign based on comparing your baseball team against these other professional baseball teams. So let's turn that a little bit and think about how it connects to physician practice valuation. The asset approach is very similar. We think about how much it would cost to build this practice from scratch. This is going to be different from specialty to specialty, but obviously it's going to require space. It's going to require equipment. It's going to require a workforce. You need to have a physician of that specialty. These are all the assets, so to speak, that you would need to compile together in terms of how you would build that from scratch. The income approach is focused on the similar principle to the baseball analogy. How much can you make as an owner in the practice? So you need to consider all of the expenses necessary to support that practice. And we'll talk a little bit about these in more detail here in a minute. But what's the residual profit that's left? and what would somebody pay for that. And then you've got the market approach. You're looking at the practice and deciding what do others pay for a similar practice. So in that case, you look up market data, you determine the comparability of the particular entity you're looking at compared to that market data, making adjustments where you need to, and coming up with an estimate of the value from that direction. Now, one key thing here, and this is the same for any valuation approach, is that you can and should utilize multiple approaches. You don't want to use just one of these. You want to think about it from all three. And then you look at your results and you compare them together, reconciling where you need to, and that helps establish a range of fair market value. So with that, we'll move into our first polling question.
First question is, which of the following is not a typical valuation approach? Market approach, income approach, buy approach, or asset approach? Remember, you must fill out the polling questions to receive CPE credit. You will have 30 seconds to answer.
So far, we're getting pretty good response rate. Like most folks have focused on the right answer.
All right, thank you for participating in our poll. Back to Matt.
Okay, yep. I think the majority of folks got it right. The buy approach is not one of the typical valuation approaches that we use. So now that we talked a little bit about how to go through that valuation process, I want to spend some time talking about some of the challenges that we see, particularly as it relates to the valuations that we're talking about today. So we'll talk about each of the approaches again. We'll expand a little bit on what we've already laid as some of the groundwork and build upon that, but talk about some of the limitations here. We'll start with the asset approach. The asset approach, when we toss this out, one of the things that people immediately say, and that's focused mostly on the folks that are selling it, whether it's physicians or owners of small business, is you hear asset and you think of that as the hard assets of the business. When you're thinking of a physician practice in particular, most physicians understand that there's not as many hard assets that go into the business as might be evidenced by the cash flows of the business, or at least the revenue of the business. So saying that a little bit differently, they see a very high revenue number, but they think that the assets themselves might not be worth that much. But it's important to talk about, is that practice operated at a profit? One of the things I mentioned and focused on with the income approach is that it's based off of actual cash flows of the business, the actual profit that somebody would be willing to come in and pay for. We'll talk about this now, and we're going to emphasize that a little bit more. But the question that always pops into my mind when somebody says that they own a profitable physician practice is thinking, is it really profitable? And what I mean by that is, have they properly adjusted for fair market value? We talked a little bit about that definition there, but you got to think about it from the standpoint of what would a willing buyer and a willing seller transact at. And one of the key pieces here that we have to think about is, what does it cost to operate this business? For physician practices in particular, the largest expense item is often going to be physician compensation. And a lot of times that's not something that's properly factored into historical financial statements. A physician who owns a business by themselves may pay themselves less than fair market value out of the business, or more than fair market value out of the business. But if somebody were to come in and buy it, they're only going to pay a set amount or a set range for that physician services. So that's what we're thinking about here when we're asking, is it really profitable? And a lot of times it may not be, frankly. I always go back to some of the examples, tying it back to the baseball analogy that we've been talking about. The New York Mets right now, if you look up some of the statistics on them, they're generating right now $550 million or more in revenue a year. That's a lot, right? Their problem is that they're spending more than $400 million just on paying their players. So if you have $550 million and you're paying $400 million just for your players, you're not left with much, right? We talked a lot about the other costs that it takes to run a baseball team, your front office, your stadium costs, your training staff, all of that. You combine all of that together, and the Mets are actually operating at a loss of over $200 million a year. So while they're generating a lot of revenue, that $550 million, it may not be overly profitable. Now, there's still things that may add value. They've got, obviously, if we're using the Mets example, a strong fan base, a good market, and there's ways to quantify all of that, but it might not be those cash flows. And I think that's important to help explain to physicians when you're talking to them, if they're the ones looking to sell a physician practice, because it helps them understand that there may be a disconnect between the revenue generation of the business and the actual cash flows at the end of the day. There's also limitations when you start looking at the income approach. We use that example with the Mets. Sometimes we'll see instances where practices have recorded compensation that is less than fair market value. In those cases, they see a big bottom line and they think that's going to be the catalyst that somebody would pay for in order to buy their business. But going back to that example, if you have $550 million in revenue, it goes a lot further if you didn't have to pay your players. The problem is you just wouldn't have a baseball team, right? So similarly here, whenever we're looking at the income approach, we want to make sure that we're making the correct analysis to determine what fair market value compensation for that position is, because that's what a willing buyer in the market would be willing to pay. We also want to think about related party transactions in physician practices. This is often going to be focused on the real estate space. We come across this a lot, and I'm sure folks on here do as well. If you're looking to engage with a physician practice in terms of a transaction, a lot of them have related space that they own, and it may be either within the entity that you're looking at or a related entity. A lot of times these physicians have seen that there's a lot of value in that real estate. When we look at that, we're thinking about what is the fair market value for that space, very similar to what we described with the physician compensation. So we want to understand what's the fair market value of that rental expense. And then if necessary, and the buyer's interested in it, then we would want to get some assistance from outside sources, including one of our affiliates, related to the value of that real estate piece, because you need very specialized skill set to understand what the value of that real estate is. We'd also want to think about one-time and non-recurring adjustments. This was particularly prevalent and something that we all saw a lot during the COVID period. There was a lot of stimulus funding, things like that were going through practices' financial statements, but that was very much limited to one-time and non-recurring events. So you've got to make adjustments to normalize those. And then we have to think about efficiencies. We'll talk about this a little bit more as we get into some of the specific buyers, but when we're thinking fair market value, it's not synergetic value. It's a little different than the case that a lot of us think about when we say, well, we could buy this business and run it a lot more efficiently because we've already got some of the supporting management in place or some of the supporting billing team members that we can utilize. We're looking at this without the benefit of those efficiencies, because that would be the value to one specific buyer, not that any willing buyer out there. Finally, there's that market approach that we talked about. whenever we're looking at this, we're always thinking, does this business compare to the market data that we have out there? There's a lot of transactions in the healthcare space. There's a lot in the physician practice industry. But when you look at that, you can't always tell a lot of details about it. A lot of times you'll see very limited information out there. You'll see perhaps 1 year of financial data, and that's very high level summary financial data. It might be limited to the revenue of the business, the earnings of the business. It might say where that entity is located, and perhaps that's as broad as a state level. There's obviously big differences between Metro New York and Albany. It may be significantly different size practices. Sometimes you see single physician practices in there. Sometimes you see thousands. So while there is some comparability, it's not the be all end all. And you hear a lot about valuation multiples. My business is worth 4 times EBITDA or 8 times EBITDA being a measure of those earnings. That's a ratio that a lot of people toss around and validate with market data, but the truth is we don't always know what's in that market data. So it's very important that you scrutinize that, and any inferences you take from that data, you need to be very cautious of how you can apply that. So with that, we'll move into our second polling question.
All right. Our second question is, which of the following information can be found in market transaction databases? Trends over time, transaction structure, date of transaction, details about market, or future outlook. Remember, you must fill out the polling questions to receive CPE credit. You'll have approximately 30 seconds to answer.
This is interesting. I'll talk about it a little bit because we're getting a little bit more of a breakdown across different answers here. But talking about some of the limitations here, there's not necessarily a lot of information about past trends and what you may see from a historical standpoint with these entities. A lot of times it's just 1 year. And going back to our discussion about one-time transactions that can skew things, a lot of times you can't see this, or whether it was a really good year for the business or a bad year for the business. It just comes back to some of those limitations over time or within that database, and being able to apply that to a number of different various businesses.
All right. Thank you for participating to the poll. Back to you, Matt.
So wrapping that section up, we'll turn a little bit into why the specialty matters, because it talks a little bit about the nuances that we all face in the healthcare industry. That there's a lot of variability in really any business that we're looking at in the way that any organization is run. So let's dive in a little bit more to why specialty matters. We've talked about all of these attributes a little bit as we've been going through this, but we'll spend a few more minutes here. What really drives the value for a business is going to be the business itself and the business practices that lead to that cash flow and lead to the economic value that somebody would pay for. So when we're looking at this, we're evaluating a number of different pieces of the business's operations and their financial performance over time. We've got ancillary services, which, using that ballpark example, it's like the concession stand that my daughter loves. As soon as we show up there, she's going to run straight to the popcorn stand, and then later on try to hit up the ice cream station and get one of those little stadium cups. Physician practices are similar in this regard. You've got things like labs, you've got imaging equipment. All of those are ancillary in nature. They're not the physician providing the service directly, but they really do lead to value in the business. Market dynamics. Again, that's one of the things we want to evaluate when we're looking at these practices. Whether it's in a rural setting or an urban setting, If it's in a market where they're having to pay more for different services, whether it's physicians or nurses, all of those will really play in as well as payer mix. We want to think about the asset structure. In the baseball example, this is how nice is the stadium. We've got billion-dollar stadiums being built these days in Major League Baseball, but we're also using some that have been around since the early 1920s or so, going back to some of the oldest parks. What are those assets that you're purchasing? How well can they be leveraged to make money in the future? Billing practices. This is one that is very specific to the healthcare industry, but we really want to think about that payer mix, how they're being leveraged. How much of a population is government payers versus commercial payers. And then we want to think about advanced practice providers, the mid-levels that you hear talked about frequently. How well a physician can leverage those, because when you leverage those correctly and leverage them well, you may be able to generate an economic benefit off the cost that you're incurring there. So let's start a little bit in the primary care space. I always think about this as the utility player on a baseball team. Just putting some broad categories into the group. This is your family medicine providers, your pediatrics, internal medicine, groups like that. When we're evaluating this, we want to think about, does the practice provide, and do they own the ancillary equipment? I think we talked a moment ago about imaging equipment. This is something that you see in some practices, but you don't see in others. And some purchase it, some lease it or get it from a third party. Even peeling that onion back a little bit more, some own brand new equipment, some own very old equipment. We've seen x-ray machines that are going 20, 30 years old now. But then we see some practices that have advanced imaging equipment that's been purchased in the past year. These are all things that can lead to value for a practice, but you need to understand the nuance behind it and understand what it is that you're buying there and how it generates economic value for the practice. And you need to think about the expenses that support it. So for imaging equipment, do you have all the techs in place? And are you able to actually generate a profit off of just that little book of business? So a lot of times we're asked to look at what is the specific piece that is adding value to a primary care practice, and you can usually isolate what the specific expenses are for that line of work, whether it's the revenue coming off of it, the techs that are used to support it. You can isolate a portion of the office that's used for it and the expense that's associated with that, the billing component, all of that, and determine how profitable is this particular service line. You also want to think about patient panel management, and this is very important when you start thinking about today, as we're seeing more and more value-based care models. A lot of these are paying physicians, particularly in the primary care space, different than what we saw maybe 10 years ago. There's emphasis on less fee for service and more on caring for a patient panel population. This may look very different in terms of a financial model. You may be focused more on how many patients you're managing over time versus previously you used to be concerned about how many procedures you're performing. You also want to give consideration to how APPs are utilized. We've mentioned this on the last slide, but particularly in the primary care model, there's nurse practitioners and others that can see the patients, depending on the billing practice, whether it's set up as incident 2 or everybody's billing personally performed. You want to understand what's going through the practice and what's the resulting cost for it. So how much are they paying for the APP? And then you've also got to think about market competition. Primary care is one of those that you see a lot of different avenues where patients are seeking that primary care, and you want to think about, is that market growing? Is it shrinking over time? There's certainly markets out there that there's a booming population. There's other areas where the population's declining, and that'll really have an impact on what a buyer can do with that business in the future. We'll turn a little bit to surgical specialties. I always classify these as those power hitters. A lot of times they're doing the surgical procedures that can often be very valuable. But when we're thinking about the practice itself, we're thinking about the professional services that this group is doing. So you've got to think about, where are they actually performing these services when you're attributing value? Are they in-office procedures? There's certainly specialties you can do some of those procedures within the office, and the collections will follow that. But a lot of times you see these done outside the walls of the practice, whether it's the ambulatory surgery center or within a hospital, depending on the specialty in the market. When they're outside of the practice, we've got to think about where those are being performed and whether there's any impact to their ability to keep doing that in the future. Similar to primary care, we've also got to think about the APPs. A lot of times you see surgical specialties where there's things like global billing. Over time, you may be billing for not just the surgical procedure, but also the follow-up care. We see frequently that APPs are utilized for those follow-up procedures. So we want to make sure that we understand the value that comes from that. That's giving the physician more time for other services, potentially. And then we need to think about any type of ancillary services that may be offered in the practice. ENT is a popular one for that, where you may see a hearing aid business that's also run out of the practice itself. Then we've got non-surgical specialties. This, in my mind, is kind of the marketable player, the one that people hear about and get really excited about. These have very unique practice patterns, and this really focuses on getting to know the business and how it operates to understand how it's valued. So radiation oncology, for example, requires very heavy fixed assets. It requires linear accelerators that may cost over $1 million a piece. Allergy physicians, they can generate a lot of revenue off of allergy shots. Pulmonology, sleep medicine is a very popular thing. We've seen sleep labs that can add substantial value to a business. Gastroenterology is one that, with scope procedures, whether that's done in an ASC or elsewhere, we need to think about how that's generating revenue for the business. And again, going back to the billing practices, making sure we understand whether this is being billed on a global basis or just the professional component. Finally, we'll talk a little bit about hospital-based specialties. These are one that I always find very interesting. I would categorize these as the free agent, because it really requires detailed understanding of the contractual agreement. It requires understanding who the other parties are, how long that contract is in effect for, any type of restrictive covenants, because you'll see things like anesthesiology practices that may have a very long, perhaps evergreen contract at a facility. They know that they will be providing services there for a substantial period of time. But then you see other practices that maybe their termination rights are every 6 months. There's certain risks there that you want to factor in. So you really need to understand the nuances of those particular practices as you're going in to evaluate them. So with that, we'll hit polling question number 3 quickly.
All right. Our third polling question is, who is the MVP on your team? The utility player, the power hitter, the marketable player, the free agent, or it takes all of them to build a team. Remember, you must fill out the polling questions to receive CPE credit. You will have approximately 30 seconds to answer.
It's looking good. Looks like we've got a lot of answers concentrated on building a team.
All right, thank you for participating in our poll. Back to Matt.
So summing up that section, just to give everybody a visual point to think about how value is really driven. We'll hit on what does or doesn't add value over time. If you're thinking of value for a physician practice, you're thinking about practices that have significant equipment, a lot of ancillary services. They're able to leverage APPs well. They've got larger workforces. Those are the types of things that really tend to lead to that increase in value as long as they're managed properly. Again, going back to the idea that you've got to look at any type of business and say, is it really profitable? You've got to make sure that they're able to generate profit off of all these items. But those are the attributes we typically see when we start to see substantial value out of a practice. You think about things that may decrease the value or make it worth less, so to speak. Specialties or practices where the services are provided primarily by the owner physician, because a lot of the revenue will be consumed by the salary expense. Going back to the idea that reimbursement is very tied to physician effort, and other practices that may not have significant transferable assets. So we'll transition a little bit into just a few other additional items that I think are helpful when thinking about how you might evaluate a practice. One, you want to think about, why are physicians selling these days? I think we've all probably seen the statistics out there, how there are fewer and fewer independent physician practices still in the market, and a lot of them over time have sold to either hospitals, health systems, and now we see more into the private equity space, the consolidator space, and even payers that are purchasing them. But if you go through the reasons that physicians often cite for this, they're looking to shift their financial risk. They're looking to get out of the business of running a practice, so to speak. They want to focus on practicing medicine versus running the business, so to speak. They want to find work-life balance. Again, you can see a lot of physician practices where the owner physician or the primary physicians are working a lot of hours between the patient care, as well as the administrative burden of running the practice. And then finally, you see a number of transactions focused on the idea of succession planning. Similar to the lower number of independent physician practices these days, we see an aging workforce. And as that workforce, and particularly the physician workforce, continues to age, there's going to be more owners that are looking to transition that practice as part of either their succession planning or their retirement plan. So when they're looking to sell, primarily we see three key buyers out there. You've got health systems, you've got private equity or the consolidators, and you've got payers that are becoming more popular. All of these have different considerations. They have different things that they may be valuing. A health system is focused a lot on fulfilling their mission, targeting any gaps that they may have in their provider workforce. They're not necessarily looking at an exit plan. Private equity, you see a little bit different. They're obviously built with a profit motive in mind. They're probably planning for a liquidity event down the road, a sell of the private equity platform. So they're going to be structured differently because they want to get that profit over time. And then payers are looking for ways to continue to reduce the cost of care over time because that's going to benefit them in the future. So they may be looking at different ways to incentivize, whether it's changes in patient panel or changes in in the way that they manage a population, but also looking at a potential exit down the road. But as we're thinking about this, again, it's a question we get frequently. How do I compete with private equity if I'm working at a health system, or how do I compete with some of these big numbers that we might see out there? And I always find it helpful to take a step back and think about where we're all starting from. Each of these buyers has different motivations. They have different approaches to deal structure. I'll elaborate on that in just a second. They have different measurements of future success. They're looking for something very different, but they're starting with that same starting point. They have that same book of business, that same revenue, the same expense structure that they may be buying. So there's really not a significant difference in what they start with, but they may structure their transaction in a little bit different way. So let's go back to where we started with value versus price. I'll tell a quick story real quick of going back to the baseball analogy of Bobby Bonilla. Some folks on here may have heard his name. Bobby Bonilla Day is coming up actually on July 1st. But for those who don't, Bobby Bonilla was a 6-time All-Star. He played all through the 90s. He had almost 300 home runs. He played for about 15 seasons. In 1999, the New York Mets wanted to release him, going back to the Mets story about maybe they overpay for players sometime. They wanted to release him, but due to contract and salary cap nuances of Major League Baseball, which I'm not going to try to cover here, he had about $5.9 million left on his contract. And they couldn't clear the space to release him and pay them, which is what they were going to be required to do. So they reached a deal to defer the amount that he was being paid. So in 1999, they signed this agreement to defer that payment, that $5.9 million. They did not pay anything for 10 years, and they agreed to pay interest at a rate of 8% over that time, and then pay it out over the next 25 years. So they basically agreed to pay him $1.2 million a year for 25 years. And again, we're talking 1999 that they entered into this agreement. Starting or continuing today, July 1st of this year even, they're going to pay him another $1.2 million. And he's going to make over $30 million from deferring that less than $6 million, just the way the transaction was structured. And I know you're asking, where does that come into play here? But it's actually a similar analogy to what we're seeing in the private equity space. We see the difference between a larger upfront payment. In that case, it may be that $5.9 million on the front end versus payment over time. In this case, it was the little over $1 million for 25 years. Now, it's not a perfect analogy, but it helps illustrate the principle. You can pay different amounts today versus different amounts tomorrow, but you're starting with the same bucket of funds, so to speak. And the private equity entrance into the physician practice market isn't much different. They've come in a lot of cases, and they do put that bigger upfront payment in place. But if to do that, they've reduced some of the expenses over time, including physician compensation. So they've reduced that over time to make that large upfront payment. In similar ways, health systems, if they contract with the physician over time, they're more like that annuitized payment. They'll continue on over time. It'll be a little bit less risk. And while you might not have that big upfront payment, you may make more in the long run. We're often brought in to help navigate these situations with folks. And again, it's often the case that you look at it, and even though they're all starting with the same bucket, that you may see different structures. But if you build out a financial model of it, you'll see a lot of it comes out to be roughly the same funds at the end of the day. So with that, we'll transition into some final takeaways for everybody. We'll play a little bit more on the baseball analogies. There may be no I in team, but there is a me. I think that's one that folks have heard, but it helps remind you that every position practice is going to be different out there. They're in a league of their own. Valuation is going to be based on the specific practice economics of the practice that you're looking at. You want to play your own game. The structure may impact price, but it does not impact the value that somebody can get out of the business. And oftentimes it's important to bring in that designated hitter. That's where a lot of times we get approached. You're looking for an appraiser who understands the nuances of the industry. And summing that up, that's why the physician practices are all created a little bit differently and treated where they may not be created, or they may not result in the same approach for all of them. So hopefully this has been helpful for everybody. I hope the stories along the way resonated a little bit, and everyone had a little bit of fun this morning. Said another way, I wanted to make sure everybody had the tools to truly play ball in this space. And I promise that's my final baseball analogy of the day. Sincerely, though, thanks for attending, and feel free to reach out if you have any questions, or if our team can do anything to help your organization. Really appreciate everybody being here today, and hope you all have a great rest of your day.
Thanks, Matt. Thanks to our presenter, Matt Warren. Later today, you'll receive an email with his information, copies of the slides, and a recording of the webinar. If PYA can help you with audit, tax, compliance, valuation, or transaction services, please contact us. You may also visit our website at pyapc.com for more details about our specific areas of expertise and to subscribe to receive PYA insights. Please remember to stay on the line once the webinar disconnects to complete the short survey for CPE credit. Once complete, your CPE certificate is downloadable via the CPE pane. Our next webinar is AI and Healthcare Cybersecurity, Risks, Compliance, and Practice with John Cross at 12:30 Eastern. If you've not yet registered, please use the link provided or visit the Thought Leadership section at pyapc.com. On behalf of PYA, thank you for joining us. We hope you'll rejoin us again shortly for our final session of PYA's Summer Symposium, Hot Topics in Healthcare. Have a great rest of your day.